Go, no, no, no. This couldn't possibly be connected. And you go, wait. Let me find that. Let me find that list. Carotenemia diseases PubMed. Here it is. Carotenemia, a review. Carotenemia is a benign condition. Vitamin A poisoning does not occur despite massive doses of carotene because the conversion of carotene to vitamin A is slow. Here we go. Hypothyroidism, diabetes mellitus, hepatic, liver, and renal, kidney diseases may be associated with carotenemia, but are not caused by ingestion of carotene. Wow. How stupid do they have to think we are? Oh, look here, folks. Hypothyroidism. Is there a problem with hypothyroidism today? Diabetes mellitus. That one either. Liver problems. I believe I saw a quote saying that hospitals expected liver conditions coming in to be increased by like an extra 50% in the next year or two. And kidney diseases may be associated with carotenemia, but are not caused by ingestion of carotene. How do you get carotenemia in the first place? By eating carotenoids. That's the only way it happens. So how would you get high carotenoids in the blood other than ingestion of carotene? How stupid do they think you are that we would believe this? You're totally orange. That's not a normal state. You have high carotenoids in your blood. You eat tons of high carotenoid vegetables because you want to eat a rainbow and you want the antioxidants and you want the polyphenols, but your health conditions that go along with this could not possibly be associated with consuming all of that stuff that is changing your blood, that is changing your skin. Are you serious? And then there's people out there who will defend that. Hope asks, is there a way to become pregnant and not become cholestatic? What would you do to fix that? I generally, what I've read in the research as to why they think cholestasis happens in pregnant women is the increase in hormones to maintain the pregnancy. It doesn't matter if they're natural hormones that the person makes. The liver still has to deal with it. That's the thing that we just have to think of. It's just, what is the liver dealing with and how can we lower the load? We don't want the body to lower its own hormones. That would be counterproductive. So what do we want to do? We want to remove everything else. I can tell you, I have multiple women on the program who have been pregnant before they worked with this stuff, and they've gotten pregnant after they worked with this stuff. They nearly always, to the person, say, the pregnancies after I started doing this were so much easier. My kid's healthier. Maybe you've been out there, for those of you people who were before, maybe you're just hearing this now, or you know this from your kids that you had before you started working with this stuff. A lot of women notice that their first child is often the healthiest, and each child after is sicker and sicker. Why is that? Because the mother and her liver were getting sicker and sicker and sicker over time, which makes for a sicker child. And then we're starting to get women who have been doing this long enough. I've only been doing this for 3 years, so it's hard to get a lot of kids, from clients and patients in 3 years. But we are seeing women saying their pregnancies are easier. And I'm pretty sure we've had at least one who said that her other kids were born unhealthy and this one was born healthier. So how do we fix it? We fix the vitamin A problem. We're trying to fix the liver with proper nutrition, avoiding toxins. Again, give the body what it needs, help the body get rid of what it doesn't want, and then get the heck out of the way. That's what we do. How do we fix that? I know one of the things, how do we know that it's a bile problem? What is one of the things that they've given pregnant women with cholestasis that seems to help their symptoms? They give them charcoal. What does charcoal do? Charcoal binds to toxic bile acids. It lowers the bile load on the system. You have, I have, we have, everybody has chronic disease because of liver injury. Chronic disease is due to liver injury and cholestasis and toxic bile getting into your blood and all the things that toxic bile contains. Vitamin A, copper, manganese, every single fat-soluble toxin you've ever been exposed to in your life, iron, aluminum, tin, nickel, mercury, cadmium, you name it, you can probably find that it's excreted in the bile. If you excrete it in the bile, but that bile goes backwards into your blood, do you realize you just poisoned yourself? How do we fix it? We fix the liver, we fix the bile ducts, we fix the leaky gut. Most of this comes about by we make the liver less toxic, which makes the bile less toxic, which means that we can fix the bile ducts so that the bile doesn't escape, which means that the toxic bile is not causing your leaky gut anymore, which means the gut can heal, so you stop getting bile into your blood, and then all of a sudden problems just go away.